guys, it's Dr. Gooch with Midland Dentistry for Kids again. You know, we see a lot of great kids throughout every day, and on special occasions we get to see our own kids. And so that's one of those days for me and for my wife. And so today we are going to see our twin baby girls who are 9 months old for their first dental visit. And so this is an appropriate time. Wanted to go and point that out, that when should we do our first visits? We've done videos on these before, but it's anywhere between 6 and 12 months. That's usually when the first teeth are showing up. And so the American Academy of Pediatric Dentistry recommends that that's when you establish the dental home. And so that's what we're doing today. We have a very responsible mother coming in and bringing her 9-month-old twins in. They both have their first 2 bottom teeth, and so it's a perfect time to want to do this exam. So we're going to take you through this experience that we have of going in and seeing our little twins here, okay? So this is Finley that we have that we're going to see first, and she's going to go and show off her teeth to us. Hopefully she won't get too mad. We've been practicing brushing at home a little bit. That's another question that a lot of moms have, is when do we start brushing? Well, when those first teeth arrive, that's when you start brushing. So we've done that a little bit with our girls. So when we're going to see, this is called a knee-to-knee exam, and that's what we do with our first visits. And so mom is going to go ahead and turn the baby around in her lap with the baby facing her, with the legs wrapped kind of around her waist. And then we form a little bit of a table right here with our knees. And then the baby's laid down and we're able to go in and see, and she's very cooperative, which is really nice, okay? And then we'll go in and we take the mirror, and mom will be in charge of hands. So she'll hold on to hands, and then we'll go in and we'll take a look. And we see that we have 2 little teeth there on the bottom. Very beautiful, okay? And we'll look at all the other tissue in here and make sure that everything else looks really good. And they're wondering what's going on with all this stuff. And we take a toothbrush here, and we go and we brush, and we demonstrate how we can brush for our moms and dads. We brush those first teeth, and usually this happens as they start pushing and spitting with their tongues, because it's a little bit new to them. And like everything else that we tried as adults, new things are a little bit difficult, okay? We just do a little bit of brush on there. A lot of times this is soothing for them with some teething issues that might be going on. From time to time we see a little bit of bleeding around the new gums of some of these teeth, and that's perfectly fine. And then we go in and we put some fluoride on there, okay? Just a little bit of fluoride because we have new teeth in there. And then we're all done, and then we say, good job, baby! We say, yay, you did your first exam! You did your first exam, that was so wonderful! And they usually make this face when they're tasting fluoride for the first time. So that's what our first exams look like, okay? So we finished with Finley. We're gonna cut this and do Blakely and see how she does for a little comparison, okay? All right, so part 2, okay, of the twinsies, all right? So this is Blakely, and we're gonna be seeing her next. So again, new visits, we start out with this first exam being a knee-to-knee exam. So we go and place the little babies on the laps with mamas. Okay, we lean them right down. We tell mamas to be in charge of hands at this point. Okay, and then we go in with a mirror and we go and see how the little babies are doing. Yes, beautiful. She has a couple of little teeth down in there, just like her sister. All right, and we go in with the brush and we go on and do a brush for them. You're not going to get shown up by that older sister. Good job. So we'll just do a little bit of brushing on there, just like we showed you with Finley. We brush off, and again, sometimes those gums can be a little bit sensitive and might have a little bit of bleeding on there, but don't let that deter you from brushing, because that's what happens with some of these while they're erupting, okay? And when they're erupting, we usually see the bottom teeth first, and then usually the top teeth come in right after that, okay? She's in a perfect spot. All of her tissues all look really good. And so we lift her up to mama and we say, yay! Good job, baby! You did it! That was super good! Very good! So this is what first exams look like at Midland Dentistry for Kids. So grateful you guys can come in and join us. This was kind of a special occasion for us, for our twins here. And so, if we can do this with 2 of these babies, then we want to see you mamas come in here and daddies come in here with your first baby. Okay, thank you so much. We appreciate all of our patients at Midland Dentistry for Kids, and we'll see you guys soon, okay? Can you say bye? Say bye, Blake. Say bye, family. Yeah. Yes, and get a picture of mama. She deserves all the credit. Yes. All right. Thank you so much. We'll see you guys soon.